You've heard it said, an ounce of prevention is worth a pound of cure. And fortunately, here in Oregon, we have both applied and realized this in most of our health industry. For example, in the medical world, we provide children's primary care checkups. And for adults, we provide annual physicals. In the dental realm, we provide periodic cleanings and exams. And in schools, we also provide dental screenings. And in the vision world, we provide annual eye exams. But Madam Speaker, we have neglected preventative care in one critical area. That's behavioral health. In behavioral health, we wait until an individual is in crisis, and then we slap them with a diagnosis that can follow them around the rest of their lives. For example, if you want your insurance to cover your mental health counseling or your mental health appointment, two things must apply: medical necessity and a formal diagnosis. Unfortunately, both of those can be detrimental to seeking counseling. One way is that if people avoid counseling for fear of that lifetime label, and the other is that if they seek counseling, they may actually have that lifetime label that hinders them later. Earlier this session, Senator Kinnemer shared a story with me. If you don't know, Senator Kinnemer was a psychologist for many years, and he was telling me many years back he had a client who came to him and was going through a terrible, nasty divorce. And in order for insurance to cover it, he was required to provide a medical diagnosis. And in a scenario like that, normally a counselor or a physician or a clinician will give a diagnosis of something along the lines of adjustment disorder, which is something you recover from, but they have to label you with something in order to get reimbursed. Well, years later, this client called him up and was devastated because this client was up for a CEO position, multi-million-dollar salary, and they had found in her medical history this diagnosis and turned her down. Now, of course, we can get into the legalities about that, but the problem is it follows people. Madam Speaker, all of us in here have experienced or heard of tragic scenarios of individuals who have died by suicide or have committed unspeakable atrocities. So often in these scenarios, family members and friends say, I had no idea of what they were going through. I had no idea that they were struggling. I never would have suspected this. And so, Madam Speaker, I ask you, what if? What if that teenager had sought counseling before getting to the breaking point? What if that parent had seen a counselor before hurting their children? What if that individual was taught to process their pain before deciding to inflict it on others? Madam Speaker, this bill is a small step at making what if a reality. House Bill 2469 is a simple sentence. It requires coordinated care organizations to provide mental health wellness appointments. Madam Speaker, the idea is that we don't want people to wait for a crisis to see a counselor. And instead, we would like to normalize seeking behavioral health counseling. Madam Speaker, this bill came about a couple of years ago. I had a great opportunity to visit with the majority leader, and we were back here talking like I do, floating the floor, and she actually brought this up, and I thought this is a great idea. And within a week, I scheduled an appointment with the Oregon Health Authority with Pat Allen, and I said, hey, let's do this. I'm going to use one of my priority bills. And he said, you know, I think we can do that in rural. Fantastic. I was very excited about that. I said, well, then I don't need a bill. Let's sit back. We can figure this out. A couple weeks later, I actually sat down with the governor, and she told me this was a great idea. She would fully support this idea. Now, in all fairness, here we are 2 years later, and we haven't prior to this bill, we haven't made progress on it. But in fairness, the Oregon Health Authority has had a lot going on over the past year. And so I don't fault them for that. And in conversations around this bill, they said, yes, we believe we can do it in rural. However, we would like the legislature to direct us to do it because we have so many other things. So if you want it done in a timely manner, you're going to have to tell us to do it. And so here we are. I do want to lay out the conversations with the work groups and with Oregon Health Authority on a couple of the guidelines that we would like them in our intention for some of the things with this. The ideas behind this is not that they just provide mental health wellness, but that the mental health wellness be provided by a mental health professional with no prior authorization, diagnosis, or medical necessity required. We would also like people to access 6 to 10, that number's been debated, but multiple sessions per year to be able to get in and see someone. For those providing these services, we'd like them to have a specific billing code unique to this so that it doesn't mess with their matrix. And we'd also, it's our intent that OHA rulemaking would not conflict with CCO contractual requirements such as behavioral health parity. Madam Speaker, I would ask that you and the rest of this chamber support this bill and help Representative Smith Warner and I normalize seeking behavioral health wellness appointments. Thank you, Madam Speaker.